Good morning, everyone. This is Dr. Herzog with episode 4 of Implant Center of Miami's Implant Dentists. I'm Dr. Tatiana Herzog, board certified oral implantologist. So today, just taking a peek at our schedule, we have 6 implant surgeries. So we'll probably place about 10 or so implants or more. And that's in our surgery column. So I wanted to talk to you guys today a little bit about how to manage the schedule. Okay, so as far as the schedule goes, I have 5 columns to keep things organized. And you might be asking, how do you do so many surgeries and still see new patients and post-ops and all of this stuff? So I'll give you the 5 columns so you can understand how we work here at Implant Center of Miami. And first and foremost, I'd like to say that staff is everything. So thanks to my amazing, well-trained staff, we're able to function like this. So first column that I have is the new patient or consults column. And this column is basically 30-minute slots for new patients. And sometimes we'll spend an hour with them, but we basically give each person at least 30 minutes once they've taken their x-rays and filled out their paperwork. And so I might see 2 new patients or an hour or so, and we'll be here for maybe 8 hours, so say about 16 new patients a day. And I like to go through the treatment plan with them and do my treatment plan really quickly, and then sit down and explain it to them while Kellen or one of the other girls is doing the financial part of it. The next column that I have is post-ops and uncovering. And so the post-ops is basically suture removal and just making sure that the surgeries have gone well. It only takes me a couple of seconds. I also answer any questions that the patients might have, and then either myself or my assistant can remove the sutures. At this appointment, I might prescribe additional antibiotics or give further instructions to the patient. Uncovering is also in the same column. The uncovering appointment is basically to check to see if the implant is ready or mature to be uncovered. At this appointment, we'll take an x-ray, and I'll let the patient know if the implant needs more time to heal or if it's ready to be uncovered. And if it is ready to be uncovered, we do it that same day. I like to use a tissue punch to make things easy and quick, and typically the uncovering shouldn't take more than about 20 minutes. Okay, so deliveries and scans. The good thing about this column is that it's not all of my work. So I have a technician here, you probably met him, Juan, and those patients that are coming for scans, Juan will come in and he'll do the scan. So he'll take complete care of that patient. Of course, I'll pop on in and make sure everything's okay, but basically he'll do the whole scan. As far as the deliveries go, I like to do the deliveries, most of them myself. I always check everything and take an x-ray, and so there is a lot of in and out for those types of things that allow me to get to my other patients as well. And most of these are screw retained crown deliveries, and then there's a couple of simple traditional crown deliveries as well. The fourth column that I have is basically a hygiene column, and so I just have one hygienist here. I know that a lot of doctors are big on the hygiene program. We are very big on keeping everything hygienic and of course going to your follow-ups, but since we are not everyone's general dentist and patients come to us more for a specialty procedure, we don't do everyone's hygiene appointment. So it's important that they come to the hygiene appointment for me to check up on their implants at least once a year. And this is to see if anything's shifted or moved or if there's any spacing. And so that's a really quick thing, and my hygienist pretty much can do the whole thing for me, and then I'll pop on in and make sure everything's okay. And then the 5th column, which is the most important column, is the surgery column. And this column is basically booked up with surgeries. And we do charge a $500 deposit for any surgery, and that's because this column gets booked out weeks and weeks in advance. So if you're having one implant, you might have 45-minute appointment or even an hour appointment. And if you're having 3 or 4 implants, you might have an hour and a half appointment. And so it's based on what the patient is doing. But typically in that column, I'll have about maybe 4 surgeries or 5 surgeries in the morning and 4 or 5 surgeries in the afternoon, and probably place about 10 implants and do several bone grafts. So that column, although it's always booked, There are certain things that happen in the surgery column that I don't have to be around for, such as taking blood pressure, taking the CT scan, placing the topical, post-op instructions, things like that. So the time that I'm actually spending with the patient is just the time that I'm placing the implant and anesthetizing them, which should only be actually a few minutes. So although they are booked for an hour and they might be here for an hour, with me, the surgery is very quick. And so sometimes it takes longer to deliver a crown than it does to place an implant. So you can see how we manage that. So 5 columns that I have are the new patient or consults, the post-ops and uncoverings, the delivery and scans, the hygiene, and the surgery column.
So if I had another patient right now, what I'd probably be doing is running to another room for a consult while this patient's getting numb. She's a little bit nervous, so we want to give her a little extra time to make sure the anesthesia totally sets in which case I'd be able to run into a consult or a post-op visit where I could cut out the sutures from an implant or whatever it may be. But in this case, we can focus totally.
Okay, on? Are you on? You need a little red light. So while I was doing the implants, there were some patients here for little flipper deliveries and things like that. I'll go in and out and check on them and make sure everything's okay. Here, Annie's going to go ahead and put the Teflon in so that we can seal up the upper right bridge that's finished, and then go on and see the rest of the patients. So today we're going to do a overdenture reline. So basically the patient has the healing abutments in, and actually one of them fell out, so we're going to replace it. But we're going to place actually locators today, and the locators are going to go in the patient's mouth, and then we're going to reline this denture so that it can snap on to her locators, and then it won't move. So if you have a denture that's uncomfortable and loose, you can get 2 implants and the denture will snap onto it, and I'll show you in just a few minutes. We're going to place the screwdriver into the locator tool like that, and then put my torque wrench over it, and you can see the torque there. This is the attachment for the locators. And this little silver one is what's actually going to go in the denture and stay inside the denture. These 3 rubber pieces can be interchanged to make the denture tighter or looser. And this is going to prevent the acrylic from going down into the gum line. So we're going to place that little rubber ring around each implant. And then we're going to place the metal one right over the top of the implant. And we're going to save these for later and make sure it still fits. And see, it's rocking a little, which means that it's engaging somewhere here, which is not good. I place a little bit of this blue bite right into the denture, and then I put the denture in the patient's mouth and press down. And there is just one spot where it is hitting right there. Just one little spot right there. So I'm going to go ahead and adjust that with a little diamond.
You want a diamond?
Uh-huh. Football. It works. If you guys saw last week's episode, I had this 5-unit bridge here, and the screw wouldn't go through the access hole. I'm not sure why. This was a lab fabricated prosthesis, and now it does. So in just what, 6 days, we got this back.
Yes.
This is zirconia. So he's got 3 implants, and here's the bridge. He can go happy out of town tomorrow. Yay! Happy.
No, te sale allá.
Oh no, thank you. You have to earn it.
Está filmando? Pega um. Está filmando?
Pegou.
Pega um. Take one. Com sorriso Maia.
Obrigado.
Smile, obrigado.
Obrigado.
Não fica aqui.
Mônica pega. Mônica. Wait. Wait. Smile. Take one.
Thank you.
This is our coffee time.
We are trying to find
Obrigado. Cheers. So this is a patient's overdenture that these attachments have worn. So like what you saw in the morning, we were replacing new ones. After a certain amount of time, you have to change these. And so, see if I could show you how to change it. And there's a tool to do this with. It's probably a better idea. Here we go. So you see they kind of just come out. These used to be clear, so definitely have. And there's that housing that you saw in the morning. And I'm going to place these clear ones. See that? So I like to place Teflon because it doesn't harbor bacteria, and you could see before it was quite a hassle to get the cotton out, but that was just what we were using before. But this one really is nice and clean. It all usually comes out in one piece. Okay, so finishing up the day here. I thought you got to see a lot of interesting things today, and try not to make these videos too bloody, so not showing you all the surgeries here. But basically, you got to see the overdenture technique, which is really great because, you know, patients are always asking me how it's done and what is it, and try to explain that even with a model in your hand, it's very difficult. So you got to see the overdenture technique of how to reline the overdenture, and then you got to see one that actually has been in the mouth for 15 years that we're just maintaining. Then the other thing you got to see is our patient from last week, the bridge that didn't fit because the screws wouldn't go through. So we had that done quickly in 3 days. It actually arrived today, and the patient came in at 3 o'clock, and then we were able to deliver that bridge, and he can go to Dominican Republic tomorrow. And if you want to see how I was troubleshooting that, you can look at last week's video. Then let's see, what else did we see? We dealt with 3 hybrid cases today, and we did take impressions for 2 all-on-4 patients who are going to be coming in next week, and actually one this week. I'm going to come in specially on a Friday for him, just because the schedule's too booked up and I really don't have anywhere to put him. So I agreed to come in the morning on Friday, and I'll take a couple hours out of my off day to see him, and that's all right. You got to see kind of like how I work the schedule, and you know, how I manage everything, and I think that's one of the biggest things. We can get into the nitty-gritty of it at a later video, and basically that is how I train my assistants to do everything that they do. You know, everything that we do is by the book, and it is you know, I'm a Girl Scout when it comes to all that stuff. So I like to make sure that everything's perfect. And I really take pride in training my assistants to be the same. So thanks for watching my video. This is Dr. Tatiana Herzog. I'm a board certified oral implantologist. That means I place and I restore implants all day long. And I'm here at Implant Center of Miami in Miami, Florida, the best place on earth. If you like my video, please like it, share it, subscribe to it, you know, send it to your dentist if you want, or one of your colleagues. And I'll see you guys next week for episode 5.